They're on the front lines of the coronavirus crisis. Healthcare workers, testing the limits of human endurance, even making the ultimate sacrifice.
And we knew COVID was coming, and in my wildest dreams, I never imagined how devastating and hard it would be.
After the struggle to contain the pandemic, what will it mean for healthcare systems and the people who run them? The burden of tackling a global health crisis has fallen more heavily on the shoulders of one group than any other. The world's healthcare workers are dealing with death and disease on a daily basis, risking their own health at the same time, and not always with the level of protection that they need.
He waves goodbye to his colleagues at the end of his shift. Olivier Lebovich has been a nurse for 30 years. He works in one of the largest hospitals in Paris, the Hôpital Cochin, right in the city centre. Lebovich looks after up to 12 patients a day on the geriatric ward. His net income is €1,735 per month. For months now, there's been virtually no time at all to pause for a break. I'm the only one working at my station and have to do everything myself. There are doctors and other nurses, but there's a lot to do. I hardly get a break. I barely have enough time for a cup of coffee in the afternoon. He's witnessed how the coronavirus pandemic pushed the French healthcare system to the brink. There were dramatic scenes at hospitals, with shortages of all types of supplies, ventilators, personal protective equipment, masks. Medical staff worked courageously, pushing themselves to sheer exhaustion. Many hospital workers became sick themselves, and some even died. The system nearly collapsed. We were not prepared for such a wave of pandemic, not at this intensity or duration. Olivier Lebovich agrees. After budget cuts and reforms, French hospitals were left with insufficient emergency room capacity and not enough staff. Doctors and nurses had to work around the clock. The COVID-19 crisis made working conditions even worse. I'm not the only one. All of us noticed just how badly things in France have deteriorated. The response? Every night at 8, the French have gone out onto their balconies to applaud medical workers. A movement that spread across the country during the stringent lockdown. Musical performances mobilised entire neighbourhoods. People were conscious of the crisis playing out in the hospitals. Emmanuel Macron admitted mistakes were made. Hospital budget cuts have been too drastic, administration too sluggish to react, staff too poorly paid. Now CGT, the influential healthcare workers union, is calling for raises of at least €300 and for the retirement age to be lowered to 55. Olivier Lebovich supports this. We need more funding, resources and personnel, but above all else we need higher wages. So he's off to protest, even though the French government has just promised to increase wages considerably and reform the healthcare system.
Well, let's speak to Professor James Buckin. He's editor-in-chief of the publication Human Resources for Health and speaks to us from Edinburgh. Professor Buckin, this really has been a tough time for healthcare workers, even beyond the sheer volume of patients they're having to deal with, hasn't it?
Yeah, very much so. What COVID has done is expose any weaknesses in health systems and health workforce numbers and deployment. And we're coming out of the initial impact of COVID with many of the same workforce problems that existed before COVID impacted.
And the sort of problems we've been seeing are also the health implications for the workers themselves. Some countries doing a better job of protecting their workers than others. We've seen that in the figures, haven't we?
We have indeed. Health workers are at the front line. They are at high risk of exposure. The International Council of Nurses, which has done some good work in analysing the variation in infection rates, suggests that on average about 7% of nurses have been affected across the 30 countries they have data for, but that varies from below 1% in Singapore up to above 20% in Spain.
And do the countries that are on the wrong side of those numbers have anything in common? Is it a case of not enough PPE? Is it a case of understaffing? Do we know?
I think there are several contributory factors. It's always difficult to isolate one and use that as the explanation, but availability of PPE was a big problem and continues to be a problem in some countries. That's heightened the risk of exposure. Where there have been shortages in staff, individuals have had to work close to patients for longer periods of time, and that has also been heightening the risk of exposure.
What about health systems themselves? We've seen them performing to varying different degrees around the world. Are there particular models of health system that have shown themselves to be effective in a pandemic like this?
I don't think a specific form or model guarantees success, but I think we can point to systems which have a localised, flexible ability to respond to differential impact in different parts of the country as being one which is better suited than a top-down, overly centralised one. I think we will see this become even more of an issue as spikes of COVID occur locally within countries. It's the ability to respond quickly locally that will be what is required to try and deal with this next phase.
And for the types of system where it maybe hasn't worked as well as it could have, is there a positive outlook? Because presumably, if you've been underfunding your system thus far, you're not now financially in a better position to do it, given the effect of coronavirus on economies.
COVID has brutally exposed the gaps in health systems and health systems funding. And as you say, the risk now is that the countries that have been worst hit by COVID are those who also need to find more resources to make good that economic damage. And there's a double whammy there. High impact of COVID, most negative impact on economy.
Well, Professor Buckin, it's been fascinating talking to you. Thanks for your time. That's Professor James Buckin, Editor-in-Chief of Human Resources for Health.
Thank you very much.
And now it's the part of the programme where you get to ask the questions. Here's our science correspondent, Derek Williams.
Can COVID-19 cause bad breath?
Halitosis can be caused by a wide range of different factors, from inadequate dental hygiene to a more serious underlying condition. But the WHO doesn't list it as a symptom for COVID-19. However, there is an interesting connection between bad breath and the virus. Mouthwash sales have spiked during the pandemic, which I guess was to be expected. I mean, plenty of people probably hope that using mouthwashes regularly will have a preventative effect, even though there's currently no evidence that gargling with them protects you. Either that or breathing into a mask all the time has made people hyper aware of how their own breath smells.
Can you catch COVID-19 from drinking unfiltered tap water?
There's no evidence you can get COVID-19 from drinking treated water, and the risk of transmission through water in general, even untreated wastewater, appears to be very low, even when the virus's genetic material can be detected in untreated water. In most cases, it's probably not viable. That's because SARS-CoV-2 is what's called an enveloped virus, which means it has a pretty fragile membrane that doesn't really protect it for very long outside the body. So standard treatment methods used in most municipal drinking water systems, like filtration and disinfection, should inactivate it, just like they do other pathogens. If you don't have access to safe treated water, then the standard precautions that you take, like boiling your drinking water, should also kill any SARS-CoV-2.
Why does Cambodia have no deaths from COVID-19?
As of this morning, at least, there have still been only around 140 cases of COVID-19 reported in Cambodia, and not a single official death. Now, with a record like that, there's of course a lot of speculation the country is underreporting. None of it confirmed. But if the official numbers are accurate, then Cambodia has a remarkable record so far, as does neighboring Vietnam. Both countries have been praised by the WHO for how they detected and responded to new cases at a very early stage of the pandemic, with extensive contact tracing and travel restrictions and quarantines as early as January, a time when most other countries weren't willing to even consider them. At the time, those measures were viewed as extreme, but retrospectively, they look like something that everyone should have been doing.
That's our science correspondent, Derek Williams. Now, they've certainly proven their worth during the coronavirus pandemic, but many healthcare workers remain some of the least well paid in their societies. Resistance to that fact, though, is growing, not least in Spain. Around 10,000 nurses staged a demonstration on Monday against their levels of pay and temporary contracts. And they made their point with a moving rendition of the 80s pop song Resistiré, which translates as I will resist. Enjoy the music. This has been the COVID-19 Special. Thanks for joining us.